Welcome back. Welcome back.
How about raising children?
Yes, and
yes,
always
there's always something going on behind the scenes.
Take it.
Take it. I am happy to introduce you, Dr. Matt Wilson, who is an interventional radiologist, not an international radiologist.
Man of mystery.
A man of international man of mystery. Because exactly, Mike, because he said we didn't know what an interventionist radiologist was. And this, of course, is Mike Beam, who you know and love, because Mike's a hoot and he's just Mr. Everyman.
They know me. I don't know if they love me, but they know me.
Oh, to know you is to love you. So, Dr. Wilson, what, pray tell, is an interventionist radiologist?
Well, I use an X-ray machine, a radiology machine of some kind or another, to guide a catheter or a needle into the body to do treatments. So it might be an ultrasound machine or a CT or an X-ray, and you can treat a lot of different diseases that way, like varicose veins or blocked arteries or veins, or one of the things that we're going to talk about today that I work with Mike with through the hospital is treatment of compression fractures in the back, where there's a fracture in the back and you can guide needles down into the bone with the X-ray machine and inject some cement into it, and that helps the pain.
So now, this is not a diagnostic tool. It's a
treatment.
A treatment.
Is this to prevent surgery?
Yes.
Okay.
Basically, these procedures that I do in general are an alternative to surgery, where you're opened up. If we can go in there with a catheter or a needle and do the treatment, it usually is a lot quicker recovery time for the patient
and
the
invasive,
procedure less invasive. So some people use the term kind of micro-invasive treatments for the things that I do, or microsurgery or interventional radiology.
Is that where science is going to?
Yeah, it's all based on technology, and so there's always something new coming out. Cancer treatment is one of the things that's really moving fast with this, where we can guide catheters into the body to treat cancers that have shown up in the liver, for instance. You can go in there and put a catheter into a tumor in the liver and zap it and get rid of it rather than having to do surgery.
Wow, so this is even better than the portal surgery, which is what we went to. Used to, people had scars this big, and now they have appendectomies with scars this big, and now we can even avoid that.
Well, it's not going to replace doing that to take out the gallbladder, for instance, but we're finding that there are new things that we can treat this way. It is replacing in large degree things like people who have blockages in the arteries. That used to be the only thing you could do for that basically would be a surgery, to do a bypass surgery. Nowadays, 9 times out of 10, we can go in there and open it up with a balloon catheter and a stent, rather than having a major surgery.
Are these done in the hospital setting, or are they done in an office setting?
There are some that are done in the office setting, like treatment for varicose veins. I can go in there with a catheter that has a laser on the tip of it, and the vein that's causing the problem, I can close it down with that laser, rather than having to do a major surgery where they strip it out of there. But most of them are done in the hospital. Most of the cases that I do are done with X-ray machine in the cath lab, which is the same place where the cardiologist does treatments on the heart, and we go in there to open up the arteries and veins and do treatments on the liver, the kidneys, or that sort of thing. But also sometimes we can use CAT scan to see where we're going, and something that we're going to start doing here is treating tumors of the kidney by using a CAT scan to guide a catheter down into the tumor and zap it and get it to shrink down. And then some of them we do in the operating room, like these compression fractures. That's done under general anesthesia, and we use the X-ray machine to see what we're doing.
Now, how new is that? You said pumping cement.
Yeah.
Is that something that was done before, but it was just done with surgery, or is that a new procedure also?
Well, it was started with surgery. Surgeons started to do this where they would put some cement in a bone to try to help hold a screw in place that they were putting into the spine. But the procedure for just a compression fracture started in Europe about 15 years ago. It's been done in the United States about the last 10 or 12 years, and we've been doing it here for about 8 years, I think. And it's something that's really taken off, because before this there was not really a good treatment for people who have a compression fracture in their back.
What is a compression fracture?
Well, the way I explain it to people is this: the bones in your back are stacked up like blocks, one on top of the other. And particularly for older people whose bones get weak, if they do something, it might be as little as lifting up some wet laundry or something, one of those bones can collapse a little bit, and that's a compression fracture. Okay. And it's real variable as to how much it hurts. Some people don't even know they have one. Some people are in so much pain they can't even get out of bed, and they have to be in the hospital getting IV medications. And for those people, and for people who take pain pills but just are really miserable, we'll go in there and do this procedure. And it's really helped out a lot, because 9 times out of 10, after they wake up, they find that the pain is way down. And so they can get up and walk out of the hospital a lot of times just almost immediately after the procedure.
Before we run out of time, I want to bring you in on this, Mike. How important are these procedures? Sounds like it's revolutionary and groundbreaking to be having these here in this area.
Well, I think so, and interventional radiologists aren't extremely common, I have to tell you. We're very blessed to have Dr. Wilson here. His father's, graced our community for a long time, and we're lucky to have him here. But I think where I always fall out is what's best for the patients, what's best for the community is in the end what's best for all of us. And to have any technology in Mountain Home, Arkansas, a town size of whatever the census says it is, 12,000 basically. I think we're very blessed to have Dr. Wilson and many other specialties here that we do.
And this is state of the art. It's happening all over the
I think so.
Now,
Yeah,
is
absolutely.
this new then, Dr. Wilson? How long have you been here in town?
I've been here doing this for, I think, about 8 years now.
8 years, okay. So is this part of the human motion, since that's you usually?
Yes,
Okay.
the spine portion of it, absolutely. We don't deal with Dr. Wilson too much with the veins and things like that, but as an institute, as an orthopedic institute, absolutely what he does ties in with bone and joint health, and absolutely is a satisfier for people and their quality of life, and it's just amazing.
Well, usually our viewers out there may spark some interest somehow. How would they contact? Who do they contact for more information? Or is this
They could reach Dr. Wilson directly. They can reach us at 508-1009, 508-1009, or they can reach Dr. Wilson. I believe it's 425-3737.
That's right, good.
Taking patients, or do you refer in from general practitioners?
I'll take direct calls from patients.
Okay.
Most of the time, people with compression fractures come through their family doctors to me. And a lot of times they're already in the hospital when I see them for the first time. Okay. And also, this community is something that's really needs something like this, because in general this is something that is for the older person. So with our demographics around here, it's something that's that we do a lot of.
Okay. Appreciate you guys coming in. Great information as always, and this is information like this always benefits our viewers. Appreciate
Great to
you
be
guys.
here. Appreciate you having us.
Thanks, and
Thank
please
you all.
come back again sometime.
All right, thanks.
Absolutely.
Up next, we have Linda Masters from the Baxter Bulletin, and she's going to talk about snacks, is what I like.
Yeah, exactly. She needs someone to help.
Stay with us. We'll be right back.